Hello, everyone. We are joined this afternoon by Ed Mantler, Natika Rewari, and Karina Rolland to speak about Roots of Hope, a multi-site community-led project that aims to reduce the impacts of suicide within communities across Canada. Welcome, everyone.
Thank you so much, Todd, and it's great to be here today. It's such an honor to be able to join you today. My name's Ed Mantler. I'm the Vice President of Programs and Priorities with the Mental Health Commission of Canada, and I'm joined for the presentation today by my colleague Nadines Story. And Nadines is the Director responsible for promotion and prevention initiatives at the Mental Health Commission of Canada. Nadines will share her screen, and we've got a few slides to share with you. I'd like to start off first by acknowledging that Nadines and I are both located in Ottawa, which is the headquarters of the Mental Health Commission of Canada and a natural gathering place, a historic gathering place here in Canada on the traditional territory, unceded unceded territory of the Algonquin Anishinaabe people, and I'd like to acknowledge the custodians of this land. The Mental Health Commission of Canada is an organization, a pan-Canadian health organization that really strives to inspire hope when it comes to mental health and substance use here in Canada and change the landscape of mental health and substance use. And I'm not sure if you can see Nadines' slides quite yet, but guided by our operational plan, our strategic plan, the Commission strives to open hearts, open minds, and open doors. And we do that by identifying best practices, promising practices and innovations, testing those, proving their value, and scaling them up across the country in an effective way. And that's part of what we'll be talking to you about today, Roots of Hope being one of those very important cornerstone initiatives of the Commission. We inspire by, I see the slides now, thanks, Nadines. We inspire by striving to achieve equity, parity between mental health and physical health, and in part doing that by influencing decision makers, organizations and individuals to put mental health at the top of the agenda. We try to create inclusive, discrimination-free programs and a discrimination-free Canada by battling the stigma that continues to cling to mental health and substance use disorders in this country. As a pan-Canadian health organization, we develop and investigate strategies to address inequities among mental health programs and services. And we strive to improve literacy and the resilience of Canadians through mental health training programs. We support, where invited, First Nations, Inuit, and Métis communities in creating meaningful solutions to address the wellness needs of those communities. And on the next slide, you'll see the four areas in which, one more slide, please, the four areas in which we really focus: population-based initiatives, including focus on individuals who are participating in the criminal justice system, older adults, youth, workplaces, e-mental health. We engage through partnerships and collaboration, and all of the work of the Commission is done in collaboration with others. We focus on mental health and substance use, including extensive research into the impacts of cannabis on the mental health of Canadians. And lastly, focus on suicide prevention, which is where we will be focusing our attention today. On the next slide, I want to talk a bit about Roots of Hope and then turn things over to Nadines. About a dozen people die by suicide each day in Canada, and that statistic has remained unchanged for a very long time. In fact, it remains today, although we know from polling and engaging Canadians throughout the last 20+ months of this pandemic that the number of individuals who have seriously contemplated suicide since the onset of the pandemic has grown substantially. So this remains an area in which we are very, very focused in terms of concern and attention. And back in 2015, we started to ask, why is that statistic not changing? It's not like there's been complete inaction. Of course, communities, organizations, and individuals are making attempts to improve things. So we asked ourselves, who's making a difference? And we brought together, in partnership with the International Initiative for Mental Health Leadership, brought together people with lived experience, service providers, scientists and educators, policymakers, a wide range of stakeholders to look at places that had made a difference. And we looked at interventions that have been put in place in the province of Quebec, in Canadian cities, in First Nations communities in Canada and the US, in the US Air Force. We even looked at programs operating in Australia and New Zealand and Europe. And we found some commonality. You know, those communities that were making a difference were taking a whole of community approach, and they were looking broadly at interventions bespoke to the needs of their community. And so the key is that broader, fully holistic approach to interventions designed for the community. And that became a made in Canada approach to a community development model for suicide prevention, which we call Roots of Hope. And I'll turn things over to my colleague Nitika to be able to speak to that more fully.
Thank you, Ed. I appreciate the time today for everyone. And again, as Ed mentioned, I'm the director in the area of prevention and promotion initiatives at the Commission. And I wanted to start today by sharing a story with you. And this is the story of Jadine. So Jadine lived in, a 14-year-old girl, lived in Rolland, Saskatchewan. And she lived with her mother, Linda, her father, Michael, and many of her siblings, Blake, Wally, Jonah, Nick, Justine, as well as Jolene. A very happy girl, an animal lover, someone who dreamt of having a veterinarian clinic open up in the north, and just a lot of pleasure to be around. She loved to help people. She loved to teach her siblings their homework and math, reading. She was very creative as well. But sadly, Linda, Michael, and her siblings lost Jadine to suicide back in 2016. It came as a surprise to the family, and there's a lot of discussion since 2016 in Rolland around how do we intervene before children, youth, and adults take their lives. And this particular initiative remained as a catalyst for Rolland continuing to think about community-led initiatives to suicide prevention and joining the Mental Health Commission of Canada in their journey to implement the Roots of Hope model. So as Ed mentioned, we're here to talk to you about the Roots of Hope model with a lot of eyes and ears to people like Jadine who are impacted and their families. The model is guided by 13 guiding principles that I wanted to share with you a little bit more information on. I'm not going to go into all of the principles, but I will highlight a few for you. The model is community-centered. What it means that it asks communities to put initiatives in place that would be community-led, that would have a whole population approach in mind, and would be culturally appropriate as well. So interventions are to be designed, implemented, and evaluated in a manner that are culturally appropriate for the local context. The model also asks for initiatives to be recovery oriented. We know that recovery is to be expected. So what does that mean for a particular community, and how is that going to shape up in programming and interventions? This model also asks for engaging people with lived and living experience and engaging them in a meaningful way to design those bespoke interventions that Ed mentioned a little bit earlier. The Roots of Hope model also consists of 5 pillars of action. And they're pillars that allow communities to build coalitions against and start to implement initiatives such as in training. What does that really mean? It means providing training and learning opportunities for our frontline workers. It could be healthcare practitioners, physicians, nurses, it could be pharmacists, it could be first responders, and really gaining their education levels and awareness levels on how to identify people who may be at risk in a community. For example, Larange, our community, Roots of Hope community in Saskatchewan, has been working to create a strong network of assist trainers and who've been able to support community members through that training program and respond when someone is feeling like they are at a risk of suicide. There's another pillar to this model, and it's called raising public awareness. So what this pillar allows you to do is use a whole of population approach and raise the awareness at the community level on all the various principles around suicide prevention, but also raising the awareness of where those programmings and supports are available in a community. For example, again, in Larange, we have been able to develop programming and radio advertising that's available not only in English, but also in Cree. And so this has been a community coalition decision, and they've identified Cree as being an important language that needs to be used in these advertisements for better reception of the messages around suicide prevention. Specialized supports is another pillar of Roots of Hope, and this allows communities to really pay attention to particular population areas that may be struggling, or pay, for example, men and their health and suicide prevention, and really pay attention to prevention, crisis, post-vention, and post-crisis services to particular audiences in their communities that may be struggling. So as an example, our partners out in Iqaluit, Nunavut, created a project where they're identifying the focus on food security being extremely important. So paying special attention to food security and how it relates to suicide prevention. Means safety is another particular pillar that's been extremely useful for communities that we work with to identify methods and places where a high number of suicides occur, and implementation of measures to ensure that safe access to them. For example, medications, safe access to medications, and making sure that those messages are there for any sort of suicides, people that are contemplating suicides, and messages of help are provided. For example, our community in Meadow Lake is working very closely with the Meadow Lake Tribal Council to ensure that their medication lockbox program is culturally appropriate, as well as accessible for First Nation communities in that area. Another pillar remains the research pillar for our project for Roots of Hope. And of course, we believe that any interventions that are implemented at a community level must be measured against their intended outcome so that we can learn from them and better understand whether those measures need to continue or improve in any way and how they need to be implemented going forward. So that's another pillar that remains part of our model, and it follows the principles of the local community and its context. So here I want to show you a little bit about who our communities are that have been implementing the Roots of Hope model across Canada. So you'll see a little bit of an animation that starts with our demonstration project communities, which are 8 communities in Canada that have been implementing Roots of Hope and allowing us to follow their journey so we can understand a little bit better on promising practices of how to implement this model. So some of those communities out in Alberta being Edmonton, we have 3 communities out in Saskatchewan that have been on this journey with us, Larange, Meadow Lake, and Buffalo Narrows. We have a community out in Ontario, Waterloo, Wellington, that's been on this journey with us for